Thank you so much, Dr. Quinn, for joining us today. We're talking about Breast Cancer Awareness Month. We know that October is Breast Cancer Awareness Month, and it is the perfect time for people to get informed and stay informed about themselves.
Oh, yes, most definitely. I mean, you would not imagine how important this topic really is, because it literally can make a difference between life and death for someone.
And Dr. Quinn, there are specific numbers of the amount of people who have been diagnosed with breast cancer. That number is pretty large. What are some things that healthcare physicians are doing to keep people informed? I know obviously getting those annual mammograms that will help, but what are some other things healthcare physicians should be doing?
Well, basically, we healthcare physicians, we have to be our patients' advocates. And I want to tell you a quick story about two patients that were referred to the same exact surgeon under different circumstances. Now, the first patient, she came in with severe back pain. She was a 58-year-old nurse, but she hadn't had a physical or mammogram in over 10 years. Well, of course, I told her that we really need to do a physical, and she agreed. We did the physical, and during the physical, it was determined that her right breast had a very large nodule. We referred her to the surgeon. But we're going to go to the second lady, the lady number two. She came in for her annual physical exam. She comes in every year and gets her mammogram. Well, this year, physical was fine. But when she got her mammogram, it was abnormal. This lady was a 54-year-old secretary. We referred her to the same surgeon. But the report for the second lady that had the abnormal mammogram, well, she did have cancer, but it was diagnosed early. It was effectively treated, and she was saved. But for our first lady that had the breast mass with the back pain, the cancer had spread all over her body to include her vertebrae. That was the pain, and there was nothing that could be done, and she soon thereafter lost her life. That's why it's so important that everyone go visit your doctor every year, get a physical exam, and follow the recommendations, because it can be the difference between life and death.
Now, there are some things that that people can do at home to kind of check themselves until they can actually see a healthcare physician. Dr. Quinn, could you tell us what those things are?
Well, just know your body. You know, you're a lady, examine your breasts in the shower. And if you feel something that's abnormal, like a mass, like that lady I talked about that had the mass, in the history, as we were doing it, she said, oh, that's been there for a while. And she was a nurse, but she was in denial. But if you have a mass in your breast, call your medical provider immediately. And also note, men can get breast cancer as well. So for men, you know, feel around. If something doesn't feel right, let us know so that we can investigate. And if you do have breast cancer, if it's diagnosed early, your life could be saved.
And that was going to bring us to our next point. A lot of men, they're not aware that they can also have breast cancer.
Most definitely. And I want to read you a couple of numbers. Now, the first number are the estimated cases by the American Cancer Society for breast cancer in America for 2021. We're looking at 281,000 people, new cases of breast cancer diagnosed in women, okay?
Wow.
2,650 are estimated to be diagnosed in men. So the bottom line is, it's estimated that men, the number of 2,650 will be diagnosed with breast cancer. Now that's significantly less than women. But when we talk about deaths, it's being estimated that 43,000 women are going to lose their life to breast cancer this year in America, and 530 men. Now, 530 is a much smaller number, but to the families of that 530 men that are projected to lose their lives, that's 100% of everything. That's why it's so important that we understand that breast cancer is something we don't want to ignore.
And Dr. Quinn, eating healthy, that's something we always talk about in our Medical Minute Mondays, but just in general, eating healthy will help to compensate for some of those habits as well.
Most definitely. But not only that, some of the research is demonstrating that there's a suggestive link between being overweight and breast cancer. Because when you're overweight, you have a higher percentage of certain hormones in your blood system that can actually make breast cancer more aggressive, or if you don't have it, it can make it so that you have a higher likelihood of developing breast cancer. So losing weight has many benefits. And as I said, a lot of the research is suggesting that being overweight can be contributory to having breast cancer.
Well, thank you so much for your time today, Dr. Quinn.
Hey, thank you for having me.